I'm going to be talking about acne and rosacea. I get a lot of questions from my patients about what ingredients and what products they should be looking for to treat these conditions at home. I also tend to see a lot of patients that come in on my scheduled for acne, but then in person they actually have rosacea and vice versa. So we're going to talk about the differences between these two conditions, as well as some key ingredients you should look for in your skincare products. So give me a second here to share my screen with you all. And we will get started. So acne essentially is an inflammatory disorder that starts actually at the level of the hair follicle, so the pores on our face. It's extremely common, and unfortunately it's not just limited to teenagers. I see patients all the way from adolescence into adulthood with this disorder. And as a dermatologist, when I'm examining your skin, what I'm trying to do is determine which acne types you have, because that's going to dictate really which types of treatment I recommend for you. So first I'll start with non-inflammatory acne. Another name for this is comedonal acne. So that's the whiteheads and blackheads on the face. This type of acne results just from buildup of dead skin and oil in our pores. It's a precursor lesion to inflammatory acne. And inflammatory acne results when those contents in the pore bust open underneath the skin, and then you get recruitment of bacteria. So that's the pink bumps, the pus bumps, nodules and cysts. And this is the type of acne that can leave behind scarring and discoloration. And then in bold, I included hormonal acne. This is really kind of a special type of inflammatory acne that I see in my post-adolescent females, and it has a very characteristic lower face, jawline, chin, can even extend onto the neck type distribution. And in reality, most of my acne patients that are female after age 18 do have some hormonal component to their acne. So this is just a nice pictorial review, again, to break down those types of acne. Over here, we've got our comedones, we've got our whiteheads and our blackheads, we've got our inflammatory acne, and then we've got our hormonal acne with that nice classic jawline distribution. So in talking about acne treatment, really the biggest takeaway is that consistency is key. It takes at least 6, if not 8 weeks to start seeing results from the ingredients you're using, and really upwards of 12 weeks. I like my patients to give their treatment regimen a solid 3-month run before we decide if we need to try something else. Some key active ingredients you can look for that don't require a prescription include benzoyl peroxide. It's a really nice anti-inflammatory, antimicrobial ingredient, really nice for that inflammatory acne. There's salicylic acid, which is a beta hydroxy acid, or BHA for short is the other name for it. And salicylic acid really can penetrate deep down into the pores to kind of clean out that oil and dead skin. So it's a really nice ingredient if you are someone that deals with a lot of comedones, the whiteheads and the blackheads. There's also AHAs, or alpha hydroxy acids. That's a separate family of acids that includes glycolic acid, lactic acid. Those acids don't penetrate down into the pores quite as deeply as salicylic acid does. They still can help kind of exfoliate the skin and clean out those pores. They also tend to have a nice brightening effect. For people who find salicylic acid too dry, AHAs can be a nice alternative. There's also azelaic acid, which is a separate family of acids. Azelaic acid does provide some gentle exfoliation as well as some anti-inflammatory and antioxidant properties, and it plays well with our AHA and BHAs. And then the last ingredient I want to highlight is retinol. So retinol is a vitamin A derivative that helps regulate skin turnover so that your pores don't have a chance to get clogged up and form acne bumps. It also boosts collagen production under the skin. So long-term use can lead to minimization of fine lines and wrinkles. So it's a kind of a powerhouse anti-aging ingredient as well. Some recommended non-prescription products that I think are really nice for my acne patients. So these are some of my favorites from our clinics that I like to highlight. The first is this Skin Medica Aha Baha Exfoliating Cleanser. It has chemical exfoliants in it because of the AHA and BHA, but it also has a really nice fine particle in it to kind of give you some physical exfoliation. So it has a really nice tingling sensation when you apply it. Really good for acne prone skin, can also really kind of brighten an even skin tone. The next product I want to talk about is the Clinical Active Serum. So this is a really unique product for acne-prone skin. It's really kind of one of its kind in the market. It's a blend of special botanical extracts that are going to promote exfoliation and reduce inflammation in the skin. If you have acne-prone skin, this is a really nice serum to apply for morning use. The next product I want to highlight includes benzoyl peroxide, which, as I said, this is a great ingredient for inflammatory acne because it is antibacterial, really helps take down inflammation quickly. This product is the MD Complete line, from the MD Complete line. It's the breakout treatment. It's got 4.5% benzoyl peroxide, so it really tends to be well tolerated on the skin. It's compounded with a lot of other nice ingredients to help reduce the irritation that benzoyl peroxide can sometimes cause. You can get products over the counter with up to 10% benzoyl peroxide in it. And the higher the concentration, the more irritating it tends to be. So this is a really, in general, well-tolerated product. You can either use it to kind of treat individual spots on the face, which I always say kind of a really thin layer, twice a day for individual spots. But if you're someone with oilier skin who tolerates this ingredient without irritation, you can definitely use a thin layer to the entire face because it will prevent new acne spots from forming. The last ingredient I want to talk about is retinol. As I said, this is a vitamin A derivative that has both anti-acne and anti-aging properties. This product is from Revision. It's the DEJ Night Cream for the face. It's got retinol in it, which can be an irritating ingredient, but in general, this is a really elegant product that's compounded with moisturizers and other things, so it tends to be very gentle, well tolerated, good for acne and anti-aging. I'm going to move on to talking about rosacea, because like I said, a lot of my patients who think they have acne come in and actually have rosacea. So rosacea does tend to be a more chronic inflammatory skin disorder than acne does. We think it's kind of a hypersensitivity really to stimuli that are usually non-noxious. Onset's typically a little later than acne, so 4th decade of life, but I do sometimes see it in patients in their 20s, and this can extend late into life. There's 4 major types of rosacea. The first is erythematothelingectatic, or vascular rosacea. This is really just characterized by facial redness, facial flushing. The next type is papulopustular, or inflammatory rosacea. This is when you do tend to start getting some acne-type lesions. It varies from acne, though, in that the lesions tend to be concentrated more in the central face, and the lesions are also a lot smaller. They're very kind of small, fine pink bumps and micro whiteheads. You may also kind of get some kind of dry red, almost eczema-like change underlying these inflammatory bumps. The third type is phymatous rosacea. This is rarer, but tends to affect men more commonly, even though rosacea is more common in women. And this is characterized by some bumpy, irregular thickening of the nose. And then the last type I want to mention is ocular rosacea. That's characterized by dry, red, burning eyes. And it is possible to have rosacea of the eyes only without any skin findings. So here's kind of just 2 nice pictures to illustrate the types of rosacea I see most commonly. So you've got the vascular type, which, as I said, is really just characterized by facial redness, more so without a ton of inflammatory lesions. Laser can be a really nice treatment for that one. And then you've got the papulopustular variant on the right. As you can see, a lot of kind of small pink bumps clustered together in the central face with a few whiteheads. So when we talk about rosacea treatment, really the most important thing that we're going for is kind of soothing the skin, reducing inflammation. So you want to look for products that are a lot more gentle than what we typically reach for to treat acne. So you want to avoid anything that causes excess irritation. And we try to counsel patients on trigger avoidance as well, which common triggers for rosacea include hot food and drinks, alcohol, spicy food, and UV light. UV light can really kind of keep rosacea active. So I counsel all my patients on the importance of really strict sun protection. As part of their treatment recommendations, I like them to use a broad spectrum SPF of at least 30 or higher every single day, rain or shine, no matter what. And I prefer the physical sunscreens, so titanium dioxide or zinc oxide. Azelaic acid is an ingredient I mentioned for acne that can actually has nice benefit for rosacea as well. And then there's certain products and moisturizers that can actually be really helpful for rosacea. So ceramides, it's a lipid that kind of helps to repair the skin barrier. And then humectants are certain classes of chemicals that actually attract water into the skin and help your skin retain hydration. So some nice products that we sell in our clinics that I like for rosacea. Number one is the SkinCeuticals Gentle Cleanser. This is a cream-based cleanser, and cream-based cleansers can be really nice for rosacea because they're not going to leave your skin with that squeaky clean feeling. You don't want to strip away all those oils. So this is going to be a really nice, gentle option that is not going to dry your skin out and cause excess irritation. A nice serum for my rosacea-prone patients is this Clinical Pro Heal Advanced Serum. This has vitamin C, which is an antioxidant. So what antioxidants do is they help protect the skin against environmental stressors, which I mentioned can be a trigger for rosacea. This combines the vitamin C, which has some nice skin brightening properties as well, with olive leaf extract, which is really going to help calm inflammation in the skin. So another kind of nice botanical product from Clinical that is really nice and soothing for my rosacea patients. Like Dr. Niemer, and Carrie, I mean, I have to put in a plug for sunscreen. I really love this Elta MD. This is what I use myself every day. And in particular for my acne and rosacea prone patients, I really like this UV Clear. It's an SPF 46. It comes tinted or non-tinted. If you are someone that struggles with melasma or other types of hyperpigmentation, the tinted may be a better option for you because that will protect you against blue light, whereas this won't. But it's broad spectrum, SPF 46, and has 9.5% zinc oxide. So this is a really, really great sunscreen for acne rosacea prone skin. And then the last product I want to talk about is this Neocutis Bio Serum Firm. This is another favorite of mine that I use every day. So this will not treat your rosacea in and of itself, but I included it because a lot of my rosacea patients don't tolerate some of the anti-aging ingredients that other patients can. And in particular, retinoids and retinol can be irritating to some rosacea patients. So in that case, patients are asking me, well, what can I do instead? And this is a serum, so there's no retinol in it, but it has growth factors and peptides, and that's going to help boost collagen production underneath the skin to minimize appearance of fine lines and wrinkles over time. This product has just like a lovely velvety feel. It's really, really nice. So when is it time to come in and see one of us about your acne or rosacea? So I always say if you're using a good mix of kind of some of the key ingredients I talked about and your conditions continuing to flare, come in because you may be reaching for the wrong things, or it may be time to up the ante on your treatment. If your breakouts are starting to leave behind discoloration or scarring, it's important to kind of get ahead of that. If your breakouts have any psychosocial implications, time to come in. And then pregnancy and breastfeeding is a very kind of special time where a lot of ingredients we like for acne in particular are totally off limits. So if you're in that stage of life, touching base with a healthcare professional is really, really important to make sure that you are using the absolute safest skincare regimen for you. And then, of course, anytime, we're happy to walk through what you're using, what your routine consists of at home, and then we can decide together if adding prescription strength treatments is indicated for you. So I really appreciate all of your time and attention, and I'm happy to take questions at this time. Okay. So the first one I see is, are there things you shouldn't do with rosacea? Clarisonic use, exfoliants, retinol treatment, etc. So in general, I advise against those types of treatments that tend to be a little more drying and irritating for my rosacea patients. Certainly, I think chemical exfoliation is one that can get the skin a little revved up, but a little bit of gentle chemical exfoliation, maybe with something like a glycolic acid or a lactic acid, may be tolerated. It depends on how severe your rosacea is, and you know, checking in with your dermatologist, they can better advise you as far as what you should use and what you shouldn't. So next, I think that one was for Carrie. So this is a great question. Since wearing face masks, I'm breaking out on my lower face. I'm in my 60s. What should I be using to prevent or treat breakouts? So this is a huge problem that we're seeing across COVID. A lot of times the breakouts are actually coming from excess breakdown of the skin barrier. So your skin barrier isn't well protected. So I always say put on a really nice bland moisturizer, something with ceramides in it before you put on your mask. I really like the Skin Medica TNS ceramide cream, or even CeraVe. I mean, the Cera part in it is for ceramides. And then the Is Clinical Active Serum, actually, a lot of my patients have found that really helpful for their acne. So you kind of get home, wipe gently with just kind of nice warm water underneath your mask, and then put that on. How do you treat ocular rosacea? Ocular rosacea is really best treated by an oral antibiotic called doxycycline. If you're concerned that you have ocular rosacea, I definitely recommend coming in for a visit so we can discuss that prescription treatment. Again, I have rosacea and wearing my mask seems to break out my chin and nose area quite a bit. What can I use? Again, I say a nice, gentle, bland moisturizer. And azelaic acid also tends to be a helpful ingredient for this. Azelaic acid, there is a prescription strength cream you can get, but it's also an ingredient that's available in a few over-the-counter products. The Ordinary makes a nice 10% azelaic acid. Paula's Choice makes an azelaic acid, and that can be kind of a nice ingredient for acne, patients. Is fungal acne a thing? My friend found a whole Reddit. Ooh, we could go down the Reddit rabbit hole. So I don't really, there is yeast that can get into hair follicles and cause a folliculitis. I typically see that more on the trunk, but fungal acne on the face is not really a thing. It's not really acne on the face if fungus is causing it. So what do I think of Mirvaso? So that's a topical medication you can apply to the skin to reduce flushing. And what about laser for the redness? Does omeprazole help? So I don't find much benefit from omeprazole. Mirvaso can be nice for some patients. The trouble is it's expensive, usually not covered well by insurance, and sometimes you can get some rebound flushing. I really think laser treatment is kind of a much better investment in your skin for durable relief of the redness.